Okay, here we go. So I'm going to say the letter C for that disease that ends in ovid. And I'm going to say the letter V for, well, you know what. Who's at risk for getting C? The CDC says risk increases with each decade after age 50. Cancer, cardiovascular disease, chronic kidney disease, chronic lung disease, diabetes, immunocompromising conditions, or the receipt of immunosuppressive medications, obesity, pregnancy, and sickle cell disease. Are there any recommendations about how to manage and treat these comorbidities before I get C? CDC says if I do get C, is there any treatment I can get started on? CDC says, no, when things get bad, go to the hospital. So let me get this right. You mean I should wait till things get really bad and then go to the hospital? CDC, yep. When I'm hospitalized, what should be done? CDC says use remdesivir. But what about all the data on kidney damage and deaths caused by remdesivir? CDC says use remdesivir. What about vitamin C, vitamin D, and zinc? CDC says there's insufficient evidence for the panel to recommend either for or against the use of vitamin C, vitamin D, and zinc in the treatment of C. What about hydroxychloroquine? The panel recommends against the use of HCQ or azithromycin for the treatment of C in hospitalized and in non-hospitalized patients. But what about the hundreds of doctors who've used HCQ combined with other drugs and nutrients to treat patients effectively, like Dr. Brian Tyson and Dr. Vladimir Zelenko? CDC says the panel recommends against the use of HCQ or azithromycin for the treatment of C in hospitalized and in non-hospitalized patients. And ivermectin? There is insufficient evidence for the panel to recommend either for or against the use of ivermectin for the treatment of C. So, all the people that died from C, how many received early care as outlined by doctors like Dr. Peter McCullough? We don't have that data. So let's review. There are no prophylaxis recommendations from the CDC, no lifestyle management guidelines. There are no early care recommendations from the CDC. Just wait till you get really bad and go to the hospital. Don't use vitamin C, don't use vitamin D, don't use zinc, don't use HCQ, don't use azithromycin, maybe ivermectin. Once you get into the hospital, you'll get remdesivir. You'll get remdesivir. You'll get remdesivir. The V. Is the CV approved? COVID says approved and authorized Vs in the US are Pfizer, Moderna, and J&J. But I thought all these Vs are still EUA. CDC, correct. So all these Vs are not approved? CDC, well, Comirnaty is. But Comirnaty has different legal protections and may be chemically different from the current Vs and is not available currently. CDC, correct. Is the V safe for pregnant women? CDC says that CV for all people who are pregnant, for all people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. It's recommended. But the recipient and physician information sheets say available data on CV administered to pregnant women are insufficient to inform V-associated risks in pregnancy. So how do you really know? CDC says V is recommended for all people 12 years or older, including people, that people word, people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. If I get V'd, can I stop wearing a mask? CDC says no. If I get V'd, can I stop social distancing? CDC says no. If I get V'd, can I still get C? On August 5th, the CDC said fully vaccinated persons can still get C. If C has 99.97% survival rate, why should I get V'd? CDC says you should get it to protect others. If I get V'd, I won't carry the virus or be contagious to others, right? I can still protect others. On March 30th, the CDC said, our data suggests that that VED people do not carry the virus. On August 5th, the CDC said what they can't do anymore is prevent transmission. And Dr. Fauci said Delta infection resulted in similarly high SARS-CoV-2 viral loads in VED and un-VED people. But, I thought the V was 95% effective. CDC, FDA, and the manufacturers say, yep, but let's do a little math. During the Pfizer trial, 8 out of 21,769 vaccinated people, oh, there's that word again, and 162 out of 21,769 un-VED people were diagnosed with C based on mild C-like symptoms, fever and cough, and a positive PCR test. Therefore, the relative effect is 154 divided by 162 times 100, or 95%. But the absolute effect is 154 divided by 21,769, which equals 0.7%. So the absolute effectiveness is 0.7%. CDC says the V is 95% effective. If I get VED, how long will it work? Well, CDC says we don't really know. And we're seeing a decrease in efficacy, so we're recommending boosters. But didn't Marian Gruber, director of the agency's Office of V's and Research and Review, and her deputy director, Phil Krause, resign over the booster issue? FDA says, yep, they did. So if I get VED, what's the advantage? CDC says it will decrease the severity of infection and hospitalizations. But doesn't the new Medicare data show that this may not be the case? That many of the VED are dying? FDA and CDC that's a lot of crickets. Has the data used to license the V been shared by the FDA, the CDC, or the manufacturers? What's the answer from all of them? And a large group of scientists and doctors have filed a request for this data. Have they received it? The FDA says it's going to take a really long time to get you this data. And you know what? We might not even send it. I got C already and recovered. Do I still need to get the V? CDC says we recommend the CV for all people with prior C infection. But there are recent data showing that natural immunity is at least as good and better than the V. Are you sure? CDC says, yep. But the research says, quote, a history of SARS-CoV-2 infection may be found to provide similar or superior immunity to V. So how do I know that the V is safe? CDC says it's safe and effective. But didn't Jessica Rose, PhD, a computational biologist, molecular biologist, and immunologist, just review all the VAERS data through August 2021, and in a recent FDA hearing stated there's a 1,000% increase for adverse events in 2021 as compared to the last 30 years of VAERS reports for all vaccines combined. The risk of using any of these C injectable products outweigh any potential benefits associated with these products. CDC and FDA. What about myocarditis? Quote, a recent study found a 4-fold increase of post-V myocarditis in those who had been previously infected with SARS-CoV-2. In light of the V-associated cardiac harms described in this report, further research as well as transparency about possible V-related harms in relation to individual child's C risks is indicated. CDC says the risk is low, so kids over 12 should get V'd, and we're working on the 5 to 11-year-olds to get the V too. Are you really sure everyone, or almost everyone, needs to get V'd? The CDC says that Joe B, says, let's finish the job, get vaccinated. Well, there's the data, folks. Links below. You decide.